SNAP is our nation's largest food assistance program with 41 million participants, which is 12.3% of the population, or about 1 in 8 Americans. You say they're going to purchase the sugary beverages with their own money anyway. That's your testimony. It's on page 3. I've never seen so many straw men set up since you watched like The Wizard of Oz.
Our research has showed that good food produces healthier outcomes.
Work
Saying it's
requirements are
only-
better than no work requirements, right?
Yes, absolutely.
With SNAP recipients being more likely than low-income non-recipients to experience diet-related disease or obesity.
I think the point is SNAP's not doing much to improve the problem.
You weren't expecting me to call you, were you? Wake up!
Good morning. I want to thank you all for being here today to discuss nutritious food in the Supplemental Nutrition Assistance Program, or SNAP. I want to welcome all of our witnesses, and I look forward to the discussion. SNAP is our nation's largest food assistance program with 41 million participants, which is 12.3% of the population, or about 1 in 8 Americans. The core mission of SNAP, as defined by Congress in the Food and Nutrition Act of 2008, is to enable low-income households to obtain a more nutritious diet and to decrease hunger and malnutrition. While the SNAP program is effective at meeting the latter part of this goal, we are failing at providing SNAP recipients a more nutritious diet. I'd like to introduce our witnesses joining us this morning. First is Dr. Angela Rachidi, I hope I pronounced that right, fellow with the American Enterprise Institute. Next is Mr. Michael Gay, an independent grocer from Claxton, Georgia, representing the National Grocers Association. Then we'll hear from Mr. Robert Seligson, CEO of the Physicians Foundation, and finally, Dr. Robert Lustig, Emeritus Professor in the Department of Pediatrics at the University of California, San Francisco. I have a question about the National Grocers Association, because in your testimony on page 2, paragraph begins, "We all share the same goal of improving the health of Americans." Do members of the National Grocers Association sell tobacco in their stores?
Some of them do, yes.
Do you?
I do.
So you sell tobacco in your stores, but you claim we all share the same goal of improving it. Do you think that improves the health of Americans?
Do I?
Yeah.
I leave those options up to the customers. It has no bearing on what I think is nutritious for my customers.
Okay, but it says we share the same goal of improving the health. So if you share that goal, why would you sell tobacco in your stores? I'm missing something here. Is it because there's a profit to be made from selling tobacco in your stores? Because customers want it?
It's because there's a customer
demand for a product that's bad for their health. You make a profit, so you sell it. I get it. And not all members of your group do. You also say that if restrictions become the law, foods not allowed on the program could be moved to out-of-pocket purchases and likely not change an individual's purchasing habits. Is that your testimony? Because there are some people who believe that. If we just say, well, you can't buy the sugary beverages with your SNAP dollar, you'll buy it with your dollar out of your pocket. But that's in your testimony. It's in black and white here. Is that true? Do you believe that?
Some of them will, yes.
Well, that's not what it says. It says likely not change an individual's purchasing habits. So when you say that you're going to go across state lines to do this, but your testimony is that individuals just going to buy it with their own money.
Yes, I was unclear on the question. Yes, if I have a choice, if customers of mine have a choice to drive 10 minutes to a store in Georgia or 10 minutes to a store in Alabama because they live on the border, they will make that decision to drive 10 minutes to Alabama.
But you say they're going to purchase the sugary beverages with their own money anyway. That's your testimony. It's on page 3. I've never seen so many straw men set up since you watched like The Wizard of Oz. I mean, this is unbelievable. You set up straw men, and in your own testimony, you contradict it. Now, you say you don't want your cashiers to be the SNAP police. Do you sell alcohol in your store?
Yes.
Oh, you do? And when you go to the checkout, does your cashier have to do anything to the person with the alcohol in their cart?
Yes, they have to check for an ID, which is a law of the land.
Sure, and the same with tobacco, right?
Correct.
So your cashiers are already policed for unhealthy things, right?
No, sir. That's a legal. Are you going to put in the pilot program that I have to check IDs for SNAP participants?
No, what we're going to say
All right,
is
well, that's how they become the police.
We're going to say you're going to limit things. So, for instance, if someone with a WIC card comes up and puts something in a basket that is not eligible for WIC, does your cashier have to say, well, you can't use your WIC funds on that?
Yes.
Oh, so they're policing WIC as well. I see. What percent of your SKUs in your supermarket are for non-SNAP eligible items? And I mean, including your pharmacy, including the aisle that has the household stuff. What percent of SKUs in your store are SNAP eligible SKUs?
Probably 90%.
90%. Your grocery store must be different from everyone I've walked in now, because if I walk down the aisle that says the dog food and cat food, and it has the household.
Yes, I understand the question. I
Okay, so,
understand. Yeah.
and you're gonna get, okay, and I'm like.
90%.
90%.
We sell mostly food. And yes, the.
Not of
police-
sales, of SKUs.
Oh, I understand your question. But you're also asking a question of policing. It's not policing WIC when somebody comes through. I just simply tell them their WIC benefits don't cover that item if they'd like to purchase it. And that is a very, very small amount of SKUs. When we stretch that to 90% of the SKUs in the store, that policing becomes a much, much larger problem.
So the mechanism's in place. I understand. Thank you.
Do you believe restricting SNAP recipients' purchases is the most effective method of changing an individual's habits and promoting better health outcomes? Could educating and incentivizing recipients to make better choices have a similar outcome? And why or why not? And start with you, Dr. Rachidi.
Yes, thank you for the question. This question was answered in a pilot project already through a randomized control trial. It tested 3 different conditions. The most effective was restrictions paired with incentives. It was more effective than restrictions only, and both restrictions only and the restrictions paired with incentives was more effective than nothing at all.
Mr. Gay.
Currently, the GusNet program, which exists in the real world, and I know an Alabama grocer that has it, people who participate in GusNip in his store buy more fruits and vegetables than any of his average American customers would. So I think the program incentivizing and giving the people that if they buy healthier foods, we will incentivize that is probably the best way to go.
Thank you. Mr. Seligson.
Thank you, Congressman. Our research has showed that good food produces healthier outcomes, and so obviously we would support programs and incentives that would encourage that. Obviously, I'm here speaking strictly from the research that our foundation's conducted and through drivers of health and the impact it has on people's health. So I would say good education and incentives for our program.
Nomination. Dr. Lustig.
Education has not solved any substance abuse any time in the history of mankind. Did Nancy Reagan's just say no work? We have an opioid crisis. In fact, the Iron Law of Public Health, which was basically developed around alcohol starting in 1613, shows that reduction in a substance reduces consumption, which reduces health harms. It's the only thing that works. And it's the only thing that has worked, and it's the only thing that will work. We have the data.
In addition to restrictions, currently, when we're dealing with food stamps, we have work requirements. What is the impact of work on the ability of a healthy adult to accommodate foods of varying health levels?
Well, we have a problem of absenteeism, and we also have a problem of presenteeism. We have people who are in their jobs and are not able to do their jobs because, number one, they're in the bathroom every hour because of their type 2 diabetes, or because they have brain fog because of their mild cognitive impairment. And so they are basically soaking up a salary and not able to do their job. So the problem is multifold, and I'm not saying it's
Work requirements are
only.
better than no work requirements, right?
Yes, absolutely. But the fact of the matter is that employers today have to pay $2,750 for health insurance per employee per year for metabolic syndrome-related diseases, whether that employee is sick or not. And that is basically breaking the bank, and it's also reducing their ability to hire more individuals.
Mr. Gay, as a grocery store owner, how have incentive programs like the Healthy Food Financing Initiative and the Gus Schumacher Nutrition Incentive Program affected your ability to provide fresh, healthy foods to your customers, especially in underserved areas?
Personally, the only experience I have with GusNip is through other grocers that I know through NGA. And like I said, one of the original pilot for that was Jimmy Wright in Alabama. And his GusNet participation was so great that the customers on GusNet actually were purchasing more fruits and vegetables than his average customers were. So that's the only personal link I have to that currently.
We detailed that since its expansion in the 60s and 70s, SNAP and other federal nutrition programs have made a lot of great progress in reducing food insecurity, which is the goal for low-income Americans and children. But you also note that SNAP is performing poorly in supporting nutrition outcomes, with SNAP recipients being more likely than low-income non-recipients to experience diet-related disease or obesity. So what is the true cause here for this disparity in health outcomes between SNAP participants and the low-income Americans who are not in the program?
It's an excellent question, because low-income people are drawn to SNAP because they need help in terms of resources. And generally, they're low-income because they don't have employment, and health issues contribute to that. So in other words, SNAP is kind of drawing already a somewhat unhealthier population because they're facing those barriers to employment. So to the question of cause, it's unclear if SNAP is causing poor health or if it's just kind of allowing SNAP participants to maintain the poor health that put them in that position in the first place.
I was going to say, are the poor outcomes new with SNAP, or is it kind of something that's always been a challenge associated with the program?
Right.
Maybe for the reasons you just kind of talked about, this vicious circle, perhaps.
Right, more always a challenge, but I think the point is SNAP's not doing much to improve the problem.
Mr. Seligson, how do you believe food costs play a role in SNAP participants accessing healthy and nutritious foods?
I think it plays a role in everybody's
Right.
economic status.
So it's cost.
Cost of food is expensive, and healthier food is probably a little bit more expensive. But I feel, in answer to your question, gets back to the same issue of social drivers. Providing the good opportunities and access to good quality foods will improve physicians' outcome.
Sure.
Advocating for physicians my entire life, or most of my entire career, I can tell you that they're under a lot of stress because of the realities of some of these things we're talking about. When patients present themselves with different diagnoses, that they can try to treat, but when the patient's not getting the right kind
Sure.
of foods they need, or access to the doctor's office, or transportation, whatever the case may be, it really inhibits the doctor's ability to get that patient better, healthier,
properly
quicker.
and makes it-
And so that's where I come from,
Right.
is that anything that we can do
Right.
to make a program
I
better.
appreciate that. I've got your message. You're there. You understand that we need to deal with that.
Given the critical role that the rural grocers play in their community, ensuring access to healthy foods while maintaining their business viability is essential. It's important to understand the obstacles that these small business owners might face. Mr. Gay, got a question for you. You weren't expecting me to call you, were you? Wake up. Mr. Gay, as a grocery operator in a rural area, I understand, what challenges do you see for your store in navigating through these potential SNAP restrictions?
If some of these restrictions were to come online, like I said before, I'm really the only access to fresh fruits and vegetables in the community. So if these loose terms that have been used for the food so far are continued to go through, I just wonder about just the pure access that people would have to any food in the neighborhood that I'm in. And also, too, when you redirect that kind of money, $122 billion, as the chairman told us earlier, could we see stuff like we saw in the pandemic, like with shortages of baby formula, WIC bread, for example? When we take those dollars and redistribute it into a very limited amount of foods, what is that going to do to the supply chain when that happens? So just those things are troublesome to me as I prepared for this. But just the access to food in a rural area, and then what happens to the supply chain.
So how might that increased bureaucracy requirements affect the ability to serve the community?
In the beginning, I mean, depending on how the rules will shape up, I mean, if I wasn't ready day one, so to speak, to take food stamps when people were in the door, would they have access to it, and would they lose access for all the other smaller dollar type stores that are in my neighborhood? Would they even have the ability to use them at those stores anymore. And so the technology piece, while it sounds like it should be easy, and it's, we have restrictions on other things, but, alcohol and tobacco are restricted by age, not by any department. So that's a whole different category. WIC is a very, very small category. It has a small flag on it. The department that food stamps is right now is all of the grocery department. So just changing that is not going to be a simple, sit down in front of the computer for a couple hours. It could literally take weeks or up to a month. I don't have an IT staff. I'm the IT staff. So working with my warehouse and, my technology providers to try to set that up, it's not going to happen overnight.
So how would you set that up without an IT staff?
You would hope that if you happen to be in one of the states that was in the pilot, that your warehouse where you buy your groceries from would be able to help you in that. And then
The labeling process?
correct. And not even that. I mean, that's another thing too that we were interested in. WIC currently by law has to be labeled on the shelf as a WIC item. I'm not sure how we would do that with food stamps, if we'd have to come up with a whole new system to label food on the shelf so that food stamp customers understood that this was now food they could buy on stamps versus right now it's basically anything on the shelf that's grocery they could buy. And it really is troublesome for me because we just spent $220,000 to buy digital tags for our store. WIC was already in that. So I'm sure the technology exists to have it changed if we had to do that, but I can't say that it does exist, and nor do I know how long it would take for that to exist. So that's a large investment that we just made that, I would hate to see go to waste.
Do you think this pilot program would be successful in achieving its goals without adding significant administrative costs?
Not currently as it stands. Like, again, just putting that stuff into a system, and again, with no federal guidance on, every state, as I've read it, seems that they would be able to pick and choose the foods they have. And again, comparable to WIC, that's a very limited amount of food. They give me those UPCs, and when the customer comes to the register, if it's not one of those UPCs, WIC does not pay for it.
So, Dr. Rachidi, in New York, you weren't going to cut because let's dispense with another straw man. Lots of straw men around here that we are cutting benefits with this proposal. I want to see it in black and white where it was ever suggested that my proposal would cut a benefit. It wouldn't cut a benefit, it would redirect spending. In your proposal in New York, what you proposed, and again, you very narrowly focused on sugary beverages. Not a whole lot of SKUs on that and pretty easy to determine, right? What were you going to do with the save? Were you just hoping people were going to buy other nutritious foods instead of non-nutritious sugary beverages?
Yes, that was the hope, but again, we were proposing a pilot program so that we could study it to see if our hypothesis that people would purchase healthier food and reduce sugary beverage purchases, we wanted to test to see if that would be the results.
But you could in fact envision where a state would say, the best of both worlds is you say, okay, we're going to restrict this, and we know based on estimates that it's about 10% of costs, 10% sugary beverage, the other 10% of the 20% are salty snacks, other sugary things. So you could say, well, okay, well, what we're going to do is we're going to give you a voucher for 10% for fruits and vegetables. So the total amount of spending is exactly the same, and you're going to substitute fruits and vegetables for sugary beverages. Now, that could be one of the proposals, couldn't it?
Yes.
Is there any doubt in any one of your minds here that that would result in healthier America, healthier people on the SNAP program? Any doubt, Dr. Lustig, that would result in a healthier outcome?
Without question, that would be a
Mr.
great
Seligson?
godsend.
Yeah, agreed, would be healthier.
Mr. Gay? About health, just talking about health.
Yes, I believe it probably would help outcomes.
Dr. Rachidi, you think it would, right?
Yes.
That's why people are frustrated with Washington, D.C. The science is so clear on this.
Sir, can I respond to the comments you made directed to me?
You may.
Just really quickly, there were two comments you made. FNS has included in their research agenda SNAP restriction pilots, showing that they do support studying this question. And to your second point about the randomized controlled trial, I have personally talked to Dr. Lisa Harnick, who ran that study.
They didn't support the one that was proposed in the 2020
They
budget.
did not support the one that was specifically in this bill, but they
Exactly.
do support SNAP restrictions,
That was
pilots.
the point that I was making.
Okay, thank you. And then I have personally talked to Dr. Lisa Harnick, who ran the pilot in the SNAP-like SNAP-like program, and that was not her finding, so I'm not sure where you drew that quote from.
Thank you all for attending this hearing. The subcommittee stands adjourned.